Audio recording for this meeting has begun.
So good afternoon, and thank you for joining us. My name is Sarah Stahlberg. I'm the Associate Director of Programs for the National Coalition of STD Directors, or NCSD. For those of you who aren't familiar, NCSD provides technical assistance to the 18 DASH-funded state education agencies on facilitating access to sexual health services. We are also a membership organization representing STD project areas throughout the country in public health departments. I'm pleased to share with you today some of the work that we've accomplished and worked on with our colleagues in Michigan in hopes that there are some adaptable tools and strategies that you can employ in your own agencies. So this is a disclaimer that shouldn't be too unfamiliar for most of you to say that the CDC funds me, but they don't necessarily endorse the contents of this presentation. So for logistics, this is just a reminder that the webinar is being recorded. The recording will be made available within a week of this presentation, and I will send out that link to everyone who has participated or for those of your colleagues who weren't able to join us. All of your lines have been muted. If you have questions or need technical help during the webinar, you can utilize the chat function in the bottom right of your screen. Myself or my colleague Leandra will be happy to assist you. All questions will be addressed at the end, but we will keep a queue, so please send them our way as they come up. I also want to flag for you that there's a box of files on your screen. We will reference some of these throughout the presentation. They are example resources from Michigan, graciously shared with you by Lori Beckhofer, who I will introduce in a moment. To access these files, click on one or more of them and then hit Download Files. We'll also send them out via email upon conclusion of this webinar. So you can meet some of today's presenters. Starting in the top left, that is me, a selfie that I took at my desk. To my right is Lori Beckhofer from the Michigan Department of Education. Lori is the DASH 1308 lead for her state education agency, and I suspect that many of you know her from her many years in this field. Lori and I have done quite a bit of work together over the last few years, specifically around SHS resources for school districts in her state, and we'll be talking about some of those today. I am also thrilled to be joined today by Asia Thompson and Jenny Lane from the Adolescent Health Initiative out of the University of Michigan. They'll share a little bit more about themselves and their work shortly. So thank you all to my co-presenters for being part of this. So for our agenda today, we'll start with an overview of sustainability, particularly in the context of the DASH-funded work, as we round out the end of year 5 of this current cooperative agreement. Lori will then share a little bit more about how she's approached the SHS work in Michigan and how she's utilized partners like NCSD and the Adolescent Health Initiative to create sustainable tools for her districts. We'll then have an introduction to the SPARK model, which you'll learn about, and a demonstration of the Facilitating Access presentation, and to have ample time for questions at the end. So, of course, we have objectives. My evaluator wouldn't have it any other way. Our objectives in hosting this webinar are for participants to be able to define sustainability in the context of facilitating access to sexual health services, analyze at least one strategy for engaging key stakeholders through short, scripted, impactful mini presentations, and to identify at least one action step to develop or adapt tools of your own. So what is sustainability? This is a buzzword that many of you have heard, I'm sure, especially in the last 6 months or so. For the purposes of our time together and throughout this cooperative agreement, NCSD has used this standard operating definition for sustainability. School districts and schools will be better positioned to achieve sustainable impact when they can effectively leverage partnerships and resources to continue programs, services, and/or strategic activities that result in improvements in the health and well-being of adolescents. So what does this look like? We have been using the OAH Sustainability Framework. Planning for sustainability can span a number of strategies, from building internal capacity to securing new funding, incorporating effective programs, practices, or policies into partnering organizations. Sustainability also involves managing and leveraging resources, financial or otherwise, and focusing broadly on community needs, which may shift over time. Effective organizations and programs adapt to these trends and grow and change with the climate. The The Health and Human Services Office of Adolescent Health has determined these following 8 key factors can influence whether a service, program, or its activities and benefits will be sustained over time. These are create an action strategy, assess the environment, be adaptable, secure community support, integrate program services into community infrastructure, build a leadership team, create strategic partnerships, and secure diverse financial opportunities. These factors provide a foundation from which education agencies can begin to build sustainability plans. Education agencies should tailor and incorporate any or all of these factors into their own unique sustainability strategies. So what does this look like specifically for SHS? We talk a lot about having formalized partnerships, an MOU or an agreement between your education agency and a public health department or another community partner or organization. You might have written policies and procedures that haven't previously been written down. Some of you who know me know that I often like to talk about phantom policies. When you go to a school district and they say, we can't do X, Y, and Z, but they can't actually cite where that's written down anywhere because it doesn't exist. This is an opportunity for us to write something down in support of making referrals for young people. You might also have an up-to-date resource guide with providers and youth-friendly clinics or organizations that you can refer students to. Germane to today's conversation are these last 2 examples, engage stakeholders and living, breathing tools and resources. Who can you recruit as an ally, and what tools and resources will outlive your initiative? So I want to take like 30 seconds or so and ask you to type into the chat box, what are some other examples of sustainability in your own SHS work? And I will read them out. Maybe some things you're working on or that you have accomplished. Anne in New Mexico says ongoing professional development. Condom distribution programs. Thank you, Tom. I like the enthusiasm. SHS referral toolkit. Thank you, Amy. Great. Well, I'm going to keep us moving, but please feel free to continue sharing some sustainability strategies that you've used in your jurisdiction, especially as we move through this presentation. So for the state education agencies on the webinar, this logo and concept of Ignite might bring back some fond memories, hopefully fond memories. Ignite is a method of presenting that's concise and to the point. It's a typical Ignite presentation is 5 minutes long. It's 20 slides with 15 seconds per slide. It is scripted. It's a method used frequently to showcase a successful project or initiative. We know that leaders in education especially wear many hats and have many different priorities. And so Ignite is a quick way to sell your work and your program to decision makers. If it's an approach that you're interested in, I am more than happy to send a link to some examples, some templates, some presentations that other education agency partners have utilized. These are all housed on Advocates for Youth's website, and I can share that link. I can also share a tip sheet in post-webinar materials so that you all can embrace this new method of presenting that can seem a little bit scary because you have to practice and rehearse, but it is another tool that I want you all to have. So finally, I just wanted to highlight a few resources for you in tackling sustainability in your SHS work. First is the Sustainability Resource Guide from the Office of Adolescent Health. A quick note that this guide has been officially removed from the Health and Human Services website, but it is archived via the link on your screen. I also wanted to, of course, highlight the 2 NCSD, CAI, and CDC branded referral system toolkit resources. And with that, I am going to pass it off to Lori to share some of her experiences. Lori, you are now unmuted.
Great. Hi, everybody. Thanks for being on the call. If I stutter or miss things as I'm talking, it's because, like you, I've been extraordinarily busy and I haven't had time to script out everything that I'm going to say. But thanks a lot for being here. And So just to give you a little bit about Michigan's background, so we have 14 priority districts that we've been working with, and the SHS piece of this project has been a little more challenging. In Michigan, we don't have a lot of school nurses. In fact, I think we're the second lowest in the country in terms of our ratio of school nurses to students. And while we have wonderful school-based health centers, many of the schools don't have school-based health centers. So I think, yeah, there's definitely unique challenges when it comes to facilitating access to sexual health services. So at the same time that I think it was challenging, I also think that our schools found it to be an important area that they wanted to work on, and one that they hadn't really thought about so much in the past. We also branded in our project, so this was the logo for facilitating access to sexual health services. Okay, you can move on to the next slide. So we are incredibly appreciative to National Coalition of STD Directors and to our colleagues in HIV and STD at the State Health Department and Adolescent Health. And we found the notebooks that you guys put together at NCSD, the big books that Sarah just featured, to be a little overwhelming and long. And so I wanted to think about a way that we could focus it down to a smaller, more usable model. And so we created this model that's just 3 pages long and has 7 steps that breaks down the key pieces around facilitating access to sexual health services. So all the things that I'm going to be talking about are things that are files that you're welcome to take, make your own. I'm all about taking other people's stuff and using it in your jurisdiction. So along with this model, also we created a processing guide that we can also share with you, although I didn't get it up on this webinar, but we can get it up later. And so that helps people to think about, where are we with respect to looking at policies, or where are we with respect to looking at, making folks aware around sexual health services. So a whole slew of things. I also, and I didn't really create a slide for this, but I kind of just wanted to share with you all of the tools that we created in our SHS work. And again, these are all done in partnership with NCSD and with our partners within Michigan and STD and HIV, etc. So this is the framework. We also early on conducted interviews and focus groups with students to see what were their barriers to accessing sexual health services. And again, we are happy to share, I think it's up there, the interview design, what the words we used, the permissions we used, all of that. But that was really helpful information in terms of seeing from the student perspective what they needed to better facilitate access. We felt that a really easy way to access sexual health services would be to literally incorporate it into your sex ed. And so, it's great to have a lesson around accessing sexual health services. And there's a lesson that the national organizations created called Keep It Simple. And so that's one of the things that is something that you can download from this webinar. And a number of our districts ended up adding to their curriculum the piece around taking a field trip to a nearby health department or site so that students it would demystify the process for them. Also, I really encouraged folks to schedule meetings with the providers in their area, and ideally to formalize their plans into a memorandum of agreement. And so a sample memorandum of agreement is another tool that you can download. And well, in general, I found that our districts didn't have a formal policy, nor did, frankly, they create a formal policy, unfortunately, around accessing sexual health services. But at a minimum, I said, make a list of the providers in your area and post that list in areas that are accessible to the students. So in the bathrooms, in the hallways, etc. And the list is really a CYA also for school staff, because if it's on the list, then they can say it's on the list and not get into trouble for endorsing a certain agency. Then if you can turn to the next page, Sarah, that'd be great. So one of the things we did more recently was we said, maybe the barrier for students accessing sexual health services is actually the adults that they work with. So whether that be parents at home or school staff, and that those folks aren't letting them know where they can get services and or helping them with resources in that arena. So we put together a survey, and the instrument also is something that should be uploaded that you can take a look at and adapt. But we just did a survey in SurveyMonkey, and we gave it to all of our districts and said, here's the link. Have your parents and or school staff in your high schools, this was focused on high schools, fill out the survey. I will say that most of the districts did it. Some of the districts only did school staff and not parents, and some did both school staff and parents. And then we fed them back their own data. You know how with SurveyMonkey you can just kind of sort by the district. And so we gave them back their own data, and then we talked about also the overall results for the state, because often the schools look pretty similar to the state as a whole. And it was really, really interesting. If you can go to the next slide. Thank you. So we learned a lot of things from the survey, but one of the things that really stood out to me, and you'll hear this later, is the whole issue that school staff didn't know where teens could get services necessarily. They didn't know who within the building could refer. They were like, that's someone else's job. That's the nurse or the school counselor, but they didn't really see it necessarily as their job. And also they had concerns about whether the school would back them up. We do have a law in Michigan that says you can't dispense a family planning drug or device. And so people are nervous about making referrals, and they're afraid that they might be breaking the law or doing something against school policy. So that was, we learned those things, but those things are all fixable. And so if you can take me to the next slide, that'd be great. So I was at a conference, and sometimes, you know, it's amazing how you have to go to a conference to learn the things that you should have known before you went to the conference. But I went there, and I saw Jenny Lane, who's a colleague from U of M, give a presentation about a model that they have of sparks. And in a nutshell, and they'll talk more about it, but a spark is basically a short in-service that's scripted, and that is really great in terms of sustainability, because people can just say, hey, I can just read this in-service, you know, read the slides, but some really great discussion around a topic of interest. And since sexual health services is something that, again, is new for a lot of people to think about in schools, I thought it would be great to do a spark specifically around facilitating access to sexual health services. And so with that, our partnership sparked, and we worked with NCSD and them and our STD partners to create the next piece and what you'll see. So we are forever grateful. And honestly, at the last Learning Collaborative meeting, when we worked with our districts, this was one of their favorite things they received over all the 5 years was this spark. So get ready to spark. That's it.
Thank you, Lori.
Bring it over to U of M.
Thank you, Sarah, and thank you, Lori. This is Jenny Lane, and I'm here with my coworker, Asia Thompson. Hello. So we say hello to all of you all out there doing this really important work towards sustainability, and we're really excited to share this opportunity with you all, which is, as Lori said, kind of sparked from the two of us connecting at our local teen pregnancy conference, Moving Towards Solutions, this last year. And I was presenting on a spark that we had created for health centers to really help them share minor consent laws, which are a complicated, often gray topic, and make it accessible and easy to share with all of the health center staff, as well as providers in health centers. And so I'm going to back up. I realize my slide has to do with our overall vision and our organization, and that really is a connection to us for that original spark, coming from this perspective that most of the work that we've done in the past is with health centers. So recognizing that health centers are a primary place where young people learn about their own health, get invested in their health, and how we can affect the healthcare landscape when we're thinking about adolescent and youth-friendly services. So with that as sort of the backdrop, really our first few years that we worked on youth-friendly care was focusing on health centers, and through the past couple years really have started to expand more to community-based organizations, in part because of receiving the Office of Adolescent Health funding as a capacity building assistance provider to teen pregnancy prevention grantees, with a specific focus on referrals and linkages to youth-friendly services. So that I recognize some of your names, some of the folks on this webinar, in part because of our partnership with you through that OAH funding. And as you know, with that funding being eliminated, we got started on it, and through that process came up with some neat sparks and some tools, and are really glad to have this chance to kind of do this piece as well. So you'll see some echoes of that work that we did in ways that, not surprisingly, that TPP grantee focus on referrals and linkages to youth-friendly services has such an overlap and lovely complement to the work with the CDC DASH funding. So some of those resources that we created are related to TA and consulting. We have our Adolescent Champion model, again with a predominantly clinical focus. But what we started to do with our OAH grantees, that we were really focusing our SPARK trainings that had originally been designed for clinical use, was partnering with agencies that wanted to provide these mini trainings to people outside of health centers and to partners who were invested in youth-friendly services. So let me just really dive into now what a SPARK is, because we keep using this language about SPARK, and I want to demystify. So in our first cohort of Adolescent Champions, we were developing these trainings, and my background is as a health educator. I'm thinking about trainings that we would do on youth-friendly services with health centers, so I'm thinking like half-day trainings. You know, we're working with these providers who are piloting our model, and we're talking about this and saying like, okay, so we'll schedule a half-day, and they're looking at me saying like, we barely meet. And when we do, we really can't give you we can give you 1 minute, one provider said to me. So we haggled and went back and forth, and we eventually arrived at this 15-minute model. And the intent was that we could prepare a PowerPoint deck and a script that would be written with language that's sort of conversational tone and a natural way to share simple ideas. We really didn't want to call it a training even. In fact, some of you may know Deb Christopher, who's just been in the field of adult learning for many years, and she was our consultant through ETR at the time. And she said, you know, Jenny, you're just really throwing money out the window if you think this is going to be a training, because it's not enough time to do knowledge transfer in that 15 minutes. But what we can do is we can spark discussion through interactive kind of approaches in these mini trainings. So thus the SPARK model was born. And the structure of all SPARKs is the same. It's kind of loosely based on some concepts from the Heath Brothers book, Switch, about making organizational change and personal change, where we appeal to people's sort of why care first. There's always a hook, and it's an approximately about 15 minutes or 5 minutes of the 15, which has to do with like, it might be a video clip or an audio clip of youth. It really grounds us some case scenarios, to help people kind of personalize and think about why this matters. And then there's a little time for key concepts and then application. So that is the structure of all of the SPARKs that we develop. We are going to participate in a SPARK in just a minute. So the one Asia is going to lead us through. And this is the one that we developed in partnership with Lori, folks at Michigan Department of Education, Michigan Department of Health and Human Services, and NCSD, thinking about our particular needs in Michigan. So before we jump in, I just have a couple more words to say about it so you have a little more context. And then we're going to kind of role play, and Asia's going to lead us through so that you can see what it's like when she actually reads the script. So she's going to really try to give you a sense of what it would be like if somebody just actually followed the script. We recommend to folks that they can personalize, you know, make the words their own if they want to make the language their own, and they don't have to read from the script. But we found that when we've observed other people delivering them, that it's relatively natural, and it's a really nice tool for people who aren't necessarily trained facilitators, or even people who just don't have a lot of prep time and want to have something that's ready to go, that they can just have this slide deck and they can just read from the script and share. So it is a really helpful tool. And I'll just mention that some of the topics that we have of these Sparks, just to give you, again, that context, we have one that we developed, again, for our TPP grantees who are working with community members, specifically around referrals, that takes place in a school setting called Being an Askable Adult. So it's, again, a 15-minute piece that could be developed or delivered at a professional development, and it's easier to get on an agenda, say at a busy PD schedule within a school where there's not a lot of opportunities to have lengthy trainings, but it's a nice way to kind of spark the discussion, again, and get people talking. So that's one of the topics. We have clinical and non-clinical versions for being youth-friendly, adolescent brain development. We have adapted them for minor consent laws and confidentiality for adolescents. And then there's a general run around best practices for confidentiality laws. So again, some are a little more clinically focused and some are for community-based organizations and work well with school personnel as well. Okay, we're going to get to how to share that towards the end of the presentation. I'm going to pop back in with where you can access all this stuff, and we'll share more resources with you at the end. But without further ado, we're going to jump into the Spark. And my last thing to say is that we made a couple of adaptations. So while she's going to be reading through the script, you can imagine that through sparking discussion, it might not be as smooth, say, if we were doing it on a webinar. So the adaptations are to accommodate the format of a webinar. So hopefully it'll be engaging, but not quite in the same way that we would do with face-to-face Spark training, which is usually how these are delivered. Okay, Asia, take it away.
Okay. Hello, everyone. I am Asia Thompson, and I am the program coordinator here at the Adolescent Health Initiative. And today's Spark is titled, How Michigan School Staff Can Facilitate Access to Health Services. Everyone can do something. So today we are going to do a 15-minute mini training, also called a Spark, which is intended to spark discussion and learning. In this Spark, we'll focus on the role school staff can play in facilitating access to health services for students, especially when it relates to sensitive topics like sexual health. Sometimes teachers and other school personnel are uncertain about what they can and cannot say to students about sexual health services, like STD testing and pregnancy prevention, within the limitations of Michigan law and school policies. Hopefully, this discussion will help clarify the issues. Okay, so first I'm going to read a scenario about an interaction between a math teacher and a student. As I read aloud, be thinking about ways that the adult could handle this situation. I'm a high school math teacher. One of my students, James, came to me after class yesterday to confide that he is concerned that he might have an STD after finding out that his partner was with someone else at a recent party. He wondered if I knew where he could go for testing. Our school doesn't have any policies about referring students for those types of services, and I was caught off guard. This isn't the first time a student has come to me with an issue. I've sent others to the guidance counselor, but I recently learned that she calls their parents. James's parents are very conservative and would be really upset if they found out he was having sex. I told him I would get back with him today. I feel like I am in a bind. Okay, now let's hear from the student. My name is James. It took me a few days to get up the nerve, but I talked to my math teacher, Mr. Brown, yesterday after class. I told him that I heard my partner, Chris, was with someone else at a party recently, and I think I should get tested for STDs. We don't have a clinic in our school, so I asked Mr. Brown where I could go without telling my parents. They freaked out if they knew that I was doing that. Mr. Brown said he understood that I needed this to stay private and said he needed to do some checking to give me the best information. I would have gone to our counselor, Ms. Wilson, but I heard she calls kids' parents when they ask about this kind of thing. Mr. Brown has always been someone I trust, so I'm sure he'll be able to help me tomorrow. So I'd like for everyone to just take a moment and reflect on your first reactions to this scenario. Think about how realistic this scenario is, and if you could see something like this happening at your school. Many adults feel uncomfortable talking with young people about sex. Some are concerned that talking about it will send a message that they're encouraging risky behaviors, and others may just not know what they should say or are allowed to say. At the same time, data from the 2015 Youth Risk Behavior Survey show that over 1/4 of high school students were sexually active. Of these teens, 43% did not use a condom the last time they had intercourse, and a full 2/3 did not use any form of medically prescribed birth control. Despite guidelines from the Centers for Disease Control and Prevention calling for sexually active individuals aged 13 and up to be tested for HIV, nearly 90% have never been tested, according to the Youth Risk Behavior Survey. When we look specifically at Michigan, the trends are similar. In 2015, nearly 14,000 Michigan teens were diagnosed with chlamydia. Cases were diagnosed in every county in the state. Teens ages 15 to 19 are 4 times more likely to have chlamydia than the overall adult population. This is especially important because chlamydia is a leading cause of infertility. Connecting teens to services where they can get testing and treatment for HIV and other STDs, as well as effective birth control, is vital to improving the sexual health of young people in Michigan. Most schools include information about sexual health in health classes. However, teens may be book smart about sexual health and still not know where to access contraception or STD testing and treatment. Our role as adults is to help them find where they can go to get the services that they need. To help us understand how teachers and parents feel about how school staff should handle this issue, Michigan Department of Education, in partnership with the Michigan Department of Health and Human Services, did a survey and asked about their knowledge, attitudes, and comfort making referrals. It turns out that parents in particular believe that the school has an important role in helping students connect to sexual health services. When asked about whether they agree or disagree with the statement, it is not the school's role to refer students for sexual health services, only 21% of school staff and 13% of parents agreed or strongly agreed. So let's think about that for a second, since the statement is phrased in the negative. This means that most teachers and even more parents believe that the school should have a role in referring students for sexual health services. On the survey, more than 1/3 of school staff indicated that they were comfortable referring students, but a number of school staff said that there were some barriers. So before we go on and actually show you guys what the results were from the survey, we're going to have you do a quick poll to find out what your thoughts are. Of the options that are listed on the screen, school staff identified 3 top reasons as barriers on the survey. So we're going to pull the poll over for you all to give us your response. But which 3 reasons do you think school staff identified as the biggest barrier to referring students for sexual health services? So this poll is set up where you are able to select more than one option, so everyone can submit 3. So we'll just give some time for everyone to respond. Okay, all right, so here we have most people felt not the appropriate person, don't have the knowledge, and are worried about repercussions from parents, school, or law enforcement. This is very similar to the survey results that we got from the school and parent survey. So, teachers were uncomfortable with giving a referral for 3 main reasons. They didn't think that they were the appropriate person to make a referral, they didn't think that they have enough knowledge, and they were worried about repercussions from parents, school, and law enforcement. So take a moment and reflect on which of these barriers resonate most for you. In this Spark, we want to address these 3 barriers so that you feel you are more knowledgeable, comfortable, and confident to help students access sexual health and other confidential services. Not surprisingly, school staff are most comfortable referring students to their family doctor. However, while minors are legally allowed to receive sexual health services without a parent's permission, in many health centers, confidentiality is not protected because of the way insurance companies are billed. Parents usually receive an explanation of benefits statement listing the services the minor received. It can be very difficult to get confidential services unless the person has Medicaid, which includes some protections for sexual health services, or when a teen receives care at health centers whose funding protects minor confidentiality. And we know from research that young people are more likely to seek sexual health services when they have the assurance of confidentiality. Health centers, school staff, and youth-serving professionals can all benefit from learning the basics about what Michigan laws allow or prohibit. Okay, so let's start with a quick quiz to see what you know about Michigan laws. These laws are different in every state, so while these in particular may not apply to you, try to think about what may surprise you about Michigan laws or how these laws compare to your own state's laws. I will be reading 4 statements. Think to yourself whether you think each is true or false. Teens have the legal right to access confidential services like mental health and substance use treatment and sexual health services without a parent's consent. A family planning drug or device, including condoms, cannot be dispensed or prescribed on school grounds. There is no state law that prohibits school staff from making referrals for STD testing and contraception to family planning agencies. There is a state law that says that school staff cannot assist a student in obtaining an abortion or make referrals specifically for an abortion. All of these statements are true. Please take a moment and reflect on this and think about what surprises you or what statement you were least certain about. There's also a handout which is attached to the file section on the webinar, and it's titled Access to SHS Laws Handout, and it explains more about some key Michigan laws in greater depth. So feel free to reference it later if you do have more questions about Michigan law. So let's apply the law to some specific situations. Are teachers required to work through the school counselor or nurse to give students referrals to outside agencies? No. Is the school counselor or teacher required to tell the parents if a student discloses that they are sexually active and would like to get birth control? No. Would a school counselor or teacher be allowed to tell a student where they can get contraception? Yes. Does it matter if the health center also provides abortion services? No. Can a health teacher do a condom demonstration? Yes. So while teachers can do a condom demonstration, there are some limitations to condoms in schools. For example, a teacher can pass a condom around a classroom for demonstration purposes, but it is against the law to distribute condoms on school property. Also, it is up to each district's Sex Ed Advisory Board to determine policy on what content is taught related to contraception. The points on this slide can be summarized with 2 main points. Point 1, given that Michigan is a state where students can't access contraception in schools or even in a school-based health center, it becomes especially important that we help facilitate access to these services in the community if they are needed. Point 2, the fact that a teacher is not allowed to make a referral for abortion services does not mean that school staff can't make referrals for contraception or STD testing to a health center that does provide abortions, like Planned Parenthood, for example. It's always best to encourage students to talk to their parents or other trusted adults about these issues. A school staff person can talk with the student about what that might look like and offer to be a part of the conversation. There may be situations, however, where the student is adamant about not wanting their parent to know. In those situations, our first instinct is to refer to a counselor, school nurse, or a school-based health center. And that makes sense, because these school professionals have more latitude to make confidential referrals, more training, and often more comfort in these areas. But students may not feel comfortable, have a rapport, or have easy access to these professionals. So ultimately, everyone in the school needs to be informed and have the knowledge and skill to make referrals. No matter what your role, whether a teacher, counselor, nurse, administrative assistant, principal, or other roles, you can help students access the health services that they need. Most of us do this because we care about young people and we want them to be healthy and supported. Students tend to come to a school staff person for a reason. It's because they trust you, and it often takes a lot of courage for them to confide in you. We want to make sure that all of you have the information, comfort, and resources to make the connection for students. In addition to knowing the laws and making yourself available to talk to students, there are some other concrete steps you can take to help connect young people to the services they need. Here are some things that we have seen other sites use effectively in their schools. Develop a list of providers and resources that young people may need to access confidential health services. Identify staff in the building who are the go-to people for helping students identify and access needed providers. Utilize student-developed posters or other PSA materials in highly visible areas. Take a moment to reflect and think about any additional ideas you might have. In the next couple slides, we will help shape some of these strategies and what they may look like in a school setting. A referral list can be a really helpful tool. Develop a list of providers and resources that young people may need to access confidential health services, like suicide prevention, substance abuse, sexual assault, STD testing, and treatment. The list can be vetted by school leaders and community partners. When we surveyed school staff about whether their school had a referral list, most indicated that they were unsure. This list can only be effective if people know about it and can easily access it. Student-developed posters or other awareness materials can be put in bathroom stalls or other highly visible areas. These posters can be about a number of health-related topics, including sexual health. Okay, so now we're going to close with a chat box discussion. I'd like for everyone to take a moment to type in an idea for a realistic strategy that could be used to help make an impact in schools' efforts to connect students to sexual health services. So if everybody could just take one moment and think of a strategy that you might want to implement in your school, and you can type that into the chat box. Okay, Billy, bathroom signs about condoms. We distribute condoms on campuses. Some principals are opposed. It would be a good way to advertise. Nice. Training teachers on identifying services in their school community. Partnering with young people to create posters to advertise youth-friendly services. Okay, those are all really great strategies. So of the strategies that we have here in the chat box, we're going to pick one. So let's go with, let's see, training teachers on identifying services in their school community. Okay, so we're going to take that strategy. And then the next thing that we're going to do is we're going to answer the question of what would need to be in place for this to actually happen in a school. So if we decided that we wanted to train teachers on how to identify the services in their school community, could you guys just type in some actionable steps that we could take to actually implement that in a school? get buy-in from the school district or school board first. Need time to train. Subs for teachers. Do one-on-one trainings with teachers during their free periods. That's a wonderful idea. Unless you did it in a Spark staff meeting. Awesome way to plug in Sparks there. Meet with local county public health. Scan the adolescent-friendly clinics, have clinic reps meet teachers, and establish MOUs. These are all awesome steps that could definitely be used to help implement this strategy in a school setting. So thanks everyone for participating. If you do have any questions, please feel free to reach out to me. My contact information is listed here on the slide, and all of our additional resources can be found on our website, adolescenthealthinitiative.org. And now I will give it back to Jenny.
Thank you, Asia. So we recognize there's still some comments coming in, so we'll make sure that in the follow-up materials, any strategies that are shared that folks aren't aware of will definitely be distributed. I want to mention that Asia and I piloted the Spark at a local high school with a group of guidance counselors. So we weren't able to get on like a massive all-school professional development, which was just fine for our purposes for piloting. It was great because guidance counselors were in a position where they felt like in the feedback they gave us that this was useful to them. They felt like they were not totally clear on all this going in and that they got a lot out of it. And we were there for 20 minutes total. So we did the Spark in 15. We had 5 minutes for Q&A at the end. And they were able to fit it into their standing weekly meeting. So it was a nice opportunity just to at least reach that smaller group of teachers and for us to pilot it and kind of get feedback on it. So I'm going to mention also just a couple more pieces about the logistics. I know that we're at 2:55 right now, but just so that folks know kind of what to expect with it. The Spark, this one clearly was written for Michigan. And they are adaptable. We just worked with the state of Illinois to adapt this exact Spark for their needs, and we contracted with them to do that. So if you're interested in having AHI do the research around the minor confidentiality laws that are relevant, any sort of state school laws, and integrate those into the actual Spark, we can do that for a nominal fee. And if you are interested in adapting it yourself, then that is an option as well. We ask that you just reach out to us so that we can partner with you and we're aware that you're adapting it. So this slide that's up right now shows you the kind of components of a Spark script, that there are video clips sometimes. So if you're interested in any of the Sparks, all of the rest are available for free on our website. And can we connect to adapt for CPS? Yes, by all means, we would be happy to. I'm going to share our contact information at the very end. Wanted to just mention, too, that the way that these scripts are set up is that there's sort of the actual narrative piece, and then there's sort of stage directions as well. And then also, I know that some of you work to think outside of the box and just work. You're not just working with school districts, LEAs, SEAs, but they are also working with community-based partnerships with community organizations. And some things that we've seen, some really creative ways for a CBO to be working with other youth-serving organizations in their community to deliver Sparks together when they're creating their referral guide together. And when they create that referral guide, they pull those representatives together, teach them, do a Spark, and then those representatives go back to their agencies to deliver those Sparks back at their sites. So there's a number of ways that it can be used creatively as a way to kind of easily disseminate this kind of easy-to-use packaged product, if you will. We have a lot of resources on our website that we'll direct you to. So we have videos, we have whiteboard video about youth-friendly services, and then our Sparks, and then posters that are also available for download for free. And of course, I need to mention our Adolescent Health Conference. Our Conference on Adolescent Health is coming up in April. It's a multidisciplinary conference. About half of our sessions are co-facilitated with adolescents, and our early bird rates end in about a week. So we hope to see you there. And then finally, I want to just do that piece that has to do with if you're interested in adapting this for your state, this particular Spark, so definitely just, you can email Asia or myself, and we will talk to you about either partnering with you to make the editable versions of these, so we'll give you the PowerPoint and the Word version, just so that we can stay in touch, partly because of branding purposes. Our name is on it, and so we just ask that we have a final look at it. But there's not a fee if you do the adapting yourself. And if we do the adapting, then there is a small fee. So happy to talk to you offline about that. And also if anyone has other questions. I noticed Lori's doing another plug. We have great resources about making health centers LGBT friendly. Oh yeah, cool. Love to see that folks are out there doing that similar kind of work so that youth feel like they know about where to go for sexual health services, and that they feel like when they get to those services that they're youth-friendly and that they're respected and affirmed there. So 2:59, if anyone has further questions, though, so happy to continue the discussion, and I'm going to just turn it back to Sarah for wrap-up.
Thank you, Jenny and Asia. That was wonderful. And my official end time on the webinar is 3:15. So we do have a few minutes if folks have questions. We'd be happy to address those. And like Jenny said, we're monitoring the chat, and we'll be downloading the chat to go through and digest and make sure that any unaddressed questions will be addressed, and we'll make sure you have all of the resources. So you can just type in if you have any immediate questions that you'd like to address. And while you're doing that, I will make a plug that when you close this window, you will be directed to an evaluation. And myself and Lori and Jenny and Asia and my evaluator would all love it if you could take just a minute or two to complete that quick survey. Any other questions? Okay, well, I'm not seeing any questions coming in, but like I said, feel free to contact us after this. Leandra just sent out the evaluation link, but you will also be automatically directed to it, and you will get it again in my follow-up email with resources. So thank you all for taking some time. I know it's a really, really busy few weeks right now, so thank you for taking the time and for being so actively engaged with us this afternoon. We really hope that you got something out of our time together, and I will yield you back your 14 minutes. Thank you.